So I'm going to take a little bit of a different take. I'm the regional advisor on the Determinants of Health for the Pan-American Health Organization, which is the regional office for the World Health Organization based in Washington, D.C. We represent 38 member states across the Caribbean and the Americas, including the United States and Canada as well. And this morning we heard from the Grand Sir Michael about the work that the Commission has done. We've just heard from Alexis as well, a very comprehensive presentation of what it means in terms of what we mean when we talk about inequities and the social determinants of health. What I'm going to do is that I'm going to talk you through some of the work that we do in the region to address the very stark inequities that we see through the approach of the social determinants of health. And if you will just allow me, I'm going to see if I can work this one. So first of all, I'm just going to give you a very quick snapshot of what we see in the region of the Americas at this point in time in terms of poverty and inequities. I'm going to talk very briefly about the Pan-American Health Organization in terms of our mission and values, primarily because equity is very much at the center of that. Then I'm going to talk about the work the Commission did and how that has benefited us in terms of the way that we work. Look at some of the advances made in the region, and for some reason something came out here, but I'm also going to talk very shortly about the international agenda and why that matters, primarily because we have a number of windows of opportunities where we can really influence the agenda and make sure that we address inequities through the approach of the social determinants of health. Okay, you know what? So, this is, I sent a revised presentation, so this is, but that's okay. I will improvise here a little bit. It's fine, it was adjusted a little bit. So I'm just gonna, should be a second presentation that I sent?
I don't have access to my system.
We are going to go with this one. So I'm just going to go through here. So what I wanted to point out, I want to start off at the sort of global level, go to the regional level, and then look at what's happening here in the United States. So we know that poverty and inequity are two of the greatest challenges of this century. And we know that 2.7 billion worldwide live on less than $2 per day. These are numbers from the World Bank. We also know that 6 out of 10 of the world's poorest people are women, and that these stark differences in economic opportunities explain significant health inequities between and within countries. We've heard a lot about, today we heard a lot about the difference in terms of life expectancy, and what the Commission identified was indeed that if you are a child born in Malawi, you may expect to live until your early 50s, whereas if you're in Japan, you're likely to live until the age of 83, and that's a life expectancy gap of a total of 36 years. If we go much closer to the region where we work, you'll see that life expectancy in the Dominican Republic is 73.5 years, whereas in Haiti is 62.2. And that's actually a gap of 11.3 years within the same island. Michael Mahmoud mentioned the example of Washington, D.C., where I currently live, and if I was to jump on the red line, you will see that within 17 metro stops, you will actually see a difference of 9 years in terms of life expectancy. So we also know that some of you may have read recently, if you follow the British newspaper, which I do, you may have read recently that Brazil has actually recently taken over the economy of that of the UK. So that's good news for the region of the Americas. But having said that, we still see very stark inequities in the region. So whilst the region of the Americas is indeed a middle-income country, it's also one of the most unequal regions in the world. And if you look at the graph on the right here, you will see that income has certainly increased very significantly over almost 30 years, but so has the gap between those who have and those who have not. So some of the challenges that we see in the region of the Americas is that of non-communicable disease. It's on the increase. We also know that a large number of our population don't actually have access to water. We also know that there is a stark difference in terms of access to health providers, and that a sort of 27% of the population is without regular access to basic health services. A continuing challenge that we see in the Americas is that of urbanization. This region is actually the most urbanized region in the developing world, with 77% of its populations living in cities. Major cities in the United States, such as Atlanta, Washington, D.C., where I'm currently based, and New York, have the highest levels of inequality in the country. And actually, those are very similar to that of Abidjan, Nairobi, and Santiago. You will also see that in Belize, Guatemala, and Peru, over 50% of the urban population live in slums, whilst in Barbados, Chile, Guyana, and Uruguay, less than 10% of the urban population lives in slums. Infant mortality ranges from 6.5% in one central area to 16% in another part of Greater Buenos Aires in Argentina. And this is just again to emphasize that when we talk about inequities, in the past we have tended to talk about inequities between countries, but it's very, very important to look at, as Lexi pointed out, at context, and it's important to point out that inequities really does exist within countries as well, and that's something that we need to address. I'm just going to go over this. So I wanted to just touch upon what we do as an organization. We are an intergovernmental organization. That means that we represent our member states. They set the agenda, and we are the secretariat, and we conduct the work that they ask us to do. And one thing that they have identified as one of our core values is indeed that of equity and Pan-Americanism. And you will see here that how we do that in practice is that, as I said, we put equity firmly on the agenda, and we do that through a number of agreements that are being done amongst our countries. So we, for instance, have our health agenda for the Americas. This is a document that has been put through by our ministries of health, setting the agenda, setting the priorities. We also have a strategic plan. We are currently developing our next strategic plan. This is very much, again, influenced by our member states. But you will see here, and Michael Mahmoud, he mentioned that, you will see how our member states are really pushing for the agenda of the social determinants of health. And they want to see that in our next strategic plan. They want to make sure that countries are accountable and that they do address the inequities that we see in the region. We also have a number of mainstreaming themes that feed into that whole issue of inequity. So you'll see that we address 6 core mainstreaming themes such as primary health care, health promotion, social protection, ethnicity, human rights, and gender. So again, we've seen this slide a number of times this morning, both in Michael's presentation and in Lexi's presentation. It is very important to take this message away. There were 3 core recommendations from the Commission on the Social Determinants of Health. 1 is to improve daily living conditions, 2 to tackle the inequitable distribution of power, money and resources, and thirdly to measure and understand the problem and assess the impact of action. And what I would again stress is that in the region of the Americas we have for a long time seen the movement of social medicine. So the social determinants of health is not something new to the region, it's something that has been addressed over a number of years throughout the history of the region. But as Michael mentioned earlier, what we have now is we have so much evidence, and this is what we're going with. So what we can really use the Commission's work for, and what we're doing in the region, is that it's really looking at the picture as a whole. It's no longer just looking at the individual without a context. Context, as Lexi says, really does matter. It's important to stress that no individual operates on its own. It has a community, it has broader socioeconomic conditions. It's important to take those issues into account. It's also a way of looking at public policies as a whole. So as we heard earlier as well, we cannot address health inequities by our own. We cannot do that as a health sector. We need to team up with other other sectors, and other sectors are also health ministries, if you like, and we need to stress that. It also allows public health professionals to look for solutions outside the health system. We know that health does not just happen within one context, it's much broader. We need to look at the environment, we need to look at education, we need to look at the socioeconomic conditions. And it provides a framework for countries to improve the health of people while empowering and encouraging fair opportunities across the life course. And then I would also mention that it also contributes to achieving the Millennium Development Goals. The Millennium Development Goals are 8 specific targets set by the global community. They are coming to an end in 2015. This is a very, very important opportunity for all of us because this is also where we can influence the agenda. There are a number of consultations taking place, and when we talk about the Millennium Development Goals, there is much to be said about the good work that has been done. But perhaps one issue that was forgotten was the notion of inequity, and that is really something that we need to put at the center when we formulate our next goals. So let me talk a little bit about the advances made in the region. When I just mentioned the Millennium Development Goals, there has been a tendency to very much look at the average. Some countries have been very, very successful in achieving some of those Millennium Development Goals, but unfortunately there's been very little focus on those communities, vulnerable and neglected communities, and that's something that we have tried to address in PAHO. I think there are many, many examples from the region in terms of participation that I think we need to share across the world. I think there is room for a lot of south to north learning as well. I think Brazil has wonderful examples of how to mobilize communities. Issues such as participatory budgeting has really taken off in Brazil, and participatory management is something that we heard recently when our Brazilian colleagues visited us in DC for the conference that was organized by the NIH. So I think one initiative we have is that of Faces, Voices and Places, and I can go into more detail, but for the sake of time I just wanted to highlight that this really is an example of how working hand in hand with the local communities where they set their priorities, this is really where we see a difference. We have also created a regional atlas of subnational vulnerability based on census data, and again highlighting those most vulnerable municipalities. We build and we share evidence, and I think that's something that's very important. I think there are a lot of wonderful lessons learned in the region of Latin America, but sometimes because those lessons learned are documented in Spanish or in Portuguese, they're not always shared globally, and that's something that we are very aware of. And that's also, we have a number of initiatives that you see here. We have observatories, we have a virtual campus where we train health professionals, professionals from other sectors in terms of the social determinants of health, in terms of issues that matter in terms of public health. And we have our Equidad listserv. This is a global listserv, but again, what I would say is that this is very important in terms of sharing the evidence that we get from the region, both in English but also in Portuguese and in Spanish. And I would also say that we're working very closely with the guys involved on the Equidad listserv, because we are currently writing a special edition on the social determinants of health for the region of the Americas, because we are seeing a real interest in the region and we want to document those best practices. A key milestone for the region was, as we heard earlier, the Global Conference on the Social Determinants of Health. This was further to the recommendations that came out from the Commission on the Social Determinants of Health. And again, we saw that countries across the world, they mobilized to document best practices, to document what they had done in terms of addressing inequities through the approach of the social determinants of health. And through that conference, the focus was very much on governance, participation, the role of the health sector, the global action on the social determinants of health, and monitoring progress. And what came out of the global conference was a Rio Political Declaration. And you will hear that's something that we talk a lot about, declarations, because as we're an intergovernmental organization, it's very important for us that we get those agreements, because this is a green light that we get to move forward the agenda and to really get some action in terms of walking the talk, as one of my colleagues would say. And this is just an example of what we did for the global conference. We held a number of regional consultations. We documented specific case studies that were shared. One case study actually came from the United States, from Brigham Young University, demonstrating that despite being ranked amongst the top 10 healthiest states in the US, life expectancy varies significantly within the state. We also saw core examples from the region. These are the countries that are often cited when we talk about how successful we've been in using the social determinants of health in addressing inequities. Costa Rica, you heard Michael Marmon talk about Costa Rica, that has for a number of years invested in their social policies in terms of education, health, school health. Similarly with Brazil, what's very significant for Brazil is a specific program that they refer to as Bolsa Familia. This is a cash transfer program that has become very, very famous, and is often cited as one of the reasons why they have managed to pull out such a high number of folks out of poverty. And Chile as well, that has a very sound system in place, and in fact accomplish all 8 of the Millennium Development Goals. So these are just some core examples, and again, there's a lot to be said about that, but for the sake of time, I'm just highlighting some of these successes. So I just wanted to address a little bit why the international agenda matters. I've talked a little bit about the Conference on the Social Determinants of Health, and I should say that we were talking just before that I'm from Denmark, and I really learned from your congresswoman, we need to be more passionate, because I am actually very passionate about this, but sometimes I think I sound too quiet or too serious. But the international agenda really does matter to us, because this is where we can really influence the agenda. When we talk about the conference, the Rio Conference on the Social Determinants of Health, the Rio Declaration came out. Countries are mobilizing around that. We are linking it to other conferences, such as the Rio Plus 20. We had member states, we had non-governmental organizations, we had academics, even folks from the private sector, meeting after 20 years when sustainable development was first reviewed. And 20 years later, what we saw as health professionals was that before there was just a focus on sustainable development, but after 20 years there was actually a recognition that these agendas need to be linked. We cannot talk about sustainable development without addressing health. The green economy will make us healthier. Environmental disasters, if we don't address that, has an impact on our health. It's important that is addressed at a very high level. Last week we had a global conference on health promotion where the core theme was that of health in all policies. You heard Dr. Jones mentioning at the beginning of the conference that we cannot work on our own. We need to work in partnership. And this, again, was a core example of how countries came together. We had 27 countries giving statements in Finland from the Americas, showing what they have done to reach out to other partners. But it's important to stress as well, it's not just about us reaching out. We also need to be able to take a backseat sometimes, recognizing that sometimes other sectors may need to take the driving seat. And as I mentioned, and now I'm being told that I'm up for time, so let me just again address the issue of the Millennium Development Goals that are now coming to an end in 2015. As a result, we are looking, the global community is looking at how do we define the next goals. And as I said, this is a real key opportunity, because all those discussions, all those consultations, all those recommendations that we have seen with the Rio Plus 20, with the Global Conference on the Social Determinants of Health, and last week in Finland on health and all policies will affect or will be able to impact this new agenda. And just to show you that this is a framework that we're currently working with, where there will be a focus on environmental sustainability, peace and security, inclusive social development, and inclusive economic development. And it is just to say that this is actually a very good example of how different sectors come together. And sometimes it is a challenge working in an intersectoral manner. And I think we should really learn from how this has been done, because it may have its flaws, but it has been one process where different sectors have come together and defined some common goals. And on that note, I think I will just give that, is just to say that they are all linked. They don't operate in isolation. And then finally, I had some conclusions that I will. So finally, just some recommendations, some conclusions. We have heard it today, but just again to just sort of reiterate it. It is really about social justice. Throughout the last couple of years, you've heard a lot about that addressing inequity is good for the economy, but it's not just about the economy. It really is a question of social justice. We also need to invest in health and education. We have seen examples from the region in the Americas and from other countries in Scandinavia, how that really makes a difference. It's also about investing in tomorrow's generation that will have a long impact, and of course developing equity-based policies, because we know that policies that promote equity can boost social cohesion and reduce political conflict. And on that note, I'd like to thank you for your attention.